Congratulations! Your journey to better health begins here. Whether it is the support and plan you need to lose up to 40 pounds in 12 weeks, or if diets have failed you and you are considering the surgical route to better health, Hurley Bariatric Center is an excellent choice. More than 6,000 people from across the state have chosen Hurley Bariatric surgeons because they are highly skilled, board-certified surgeons who not only specialize in bariatric surgery, they also save lives daily as critical care and trauma surgeons. Hurley's Bariatric Center is nationally accredited and is a Blue Cross Blue Shield Blue Distinction Center. Today, Hurley registered dietitian nutritionist Hannah Welter is going to walk you through the medical weight loss programs at Hurley Bariatric Center. These are successful, non-surgical weight loss programs that can finally help you get the weight off and keep it off. Plus, she'll explain how you can get a $100 discount just for those watching right now. Then Dr. Christopher Wong will share everything you need to know if you are considering bariatric surgery. What's great about you joining us live is that they'll answer questions live right after their presentations. All you have to do is text me, don't call, at 248-935-2562. You can also post your questions on Facebook or YouTube. Let's get started by welcoming Hannah Welter.
Hello. So, as we talk about the management of overweight and obesity, I think it's important to first talk about and define what overweight and obesity really is. We can look at somebody's weight and classify it into different categories, whether that's underweight, a normal weight, overweight, or obese, based on somebody's BMI. So your BMI, or your body mass index, this is basically just a number that we can use. It's a simple calculation that utilizes your height and your weight to give us that number. And then based on that number, we can classify your weight into those other subcategories. So an overweight BMI would range from 25 to 29.9, while an obese BMI would range from 30 and higher. If you're not aware of what your BMI may be, there's multiple free calculations that you can look up online, and they can tell you what your BMI really is. I think it's also really important to note that when we talk about overweight and obesity, it's not typically caused by one thing. So overweight and obesity, it really is multifactorial. It's not just, oh, I eat more or I work out less and this causes that overweight or that obesity. There are many things that can affect that, including maybe the environment that you live in, your genetics, possibly other chronic health problems like thyroid disorders or Cushing's disease or PCOS, maybe a medication that you have to take that's causing some weight gain as well. So I think it's important to note that when we talk about the overweight and obesity, it really isn't just maybe I don't eat the healthiest foods or maybe I don't work out as much as I should, but there's a lot of things that usually contribute to somebody's weight. As we talk about the management of the overweight and obesity, there are many different ways that we can manage that. Many different programs, as I talk about our non-surgical medical weight loss program, we take into consideration a lot of these different areas that we can use and we can talk about to help manage your weight, whether that be diet, physical activity, maybe it's behavior therapy, medication in terms of weight loss medication, or even bariatric surgery, which we will hear about in a little bit, but also that non-surgical medical weight loss program as well. So what is the non-surgical medical weight loss program at Hurley really all about? So the main things that we really focus on, so we strive to help people and we really strive to help you achieve that better health and that better quality of life overall. In conjunction with that, we also show you how to make those behavior changes. Those behavior changes are what really lead to that long-standing weight loss. It's really the foundation of lifestyle change for you. We'll also teach you how to make those positive diet and lifestyle changes as you go throughout the non-surgical medical weight loss program. We will give you what your food choices should look like, what that physical activity should be, and things like that. And then we really pride ourselves on supporting you throughout the entire process. We're always just one phone call away, but you'll also be coming in to see us in person as well. So, who is eligible for the non-surgical medical weight loss program? First of all, you have to be an adult, so 18 years of older. We would prefer a BMI of greater than 25. If you're interested in losing an average of 30 to 40 pounds throughout that 12-week program, that's typically on average the amount of weight loss we see during that time. You have to be ready to commit to those diet and lifestyle changes, and I really want to emphasize that one. Those lifestyle changes are what's really going to lead to that long-term weight loss that we keep talking about. And then, of course, if you're ready to enjoy that better health and a better quality of life. So, how does this program work, the non-surgical medical weight loss program? It's pertinent to note that the program is not covered by insurance. So, the total program fee is $599, which, like I said, that's not covered by insurance. However, I will talk about the discount that we mentioned earlier. The fee, so that covers all of the nutrition supplements that you'll need throughout the program. It also covers the majority of all the visits, so whether that be the dietitian visits, if you're seeing a registered nurse, a medical assistant, all of the education material that you receive during that time as well, that's all within that fee. We base the non-surgical medical weight loss program on the 4 pillars of weight management, and that's per the Obesity Medicine Association. So those 4 pillars are nutrition, physical activity, behavior, and then medication. Like I mentioned earlier, that weight loss medication if that's indicated for you as well. So, like I mentioned, the non-surgical medical weight loss program, this is a 12-week program, and it's important to note that it's an individual program. So you're not going to be in a group with other people, so it's very individualized. Expect to come in weekly for those 12 weeks. We do those weekly visits, whether you're meeting with a registered dietitian like myself, or a registered nurse, maybe a physician assistant, or a nurse practitioner, maybe a medical assistant. So you'll be meeting with somebody each week throughout those 12 weeks. During those 12-week visits, you'll have weekly weigh-ins. We will do your labs. You get initial labs done, and then we also get your labs done again at the end of the 12-week program. And that gives us a lot of insight on terms of different things. I guess one example for you, if we look at something called your A1C, which is something that refers to like diabetes prognosis and things like that, we can see if it improved throughout those 12 weeks. So those labs give us a lot of insight for you. You'll also receive that medical monitoring, like I said, either with a physician assistant or a nurse practitioner. You'll receive those educational handouts, and those handouts talk about nutrition, exercise, behavior, things like that. There will also be educational videos that you can choose to have through your email, and then medication, like I had mentioned, if that is appropriate for you at that time as well. So, the different phases throughout the 12-week program. The first 2 weeks, we consider that the jump phase of the program. During the first 2 weeks, you will be on only nutrition supplements. So that would basically be a combination of like protein shakes, meal replacement shakes, as well as high protein snacks, such as protein bars, protein chips, whatever it may be that you choose. Those first 2 weeks, we consider those jump phase because it really gives people that motivation to continue down that path. Typically, we see a good amount of weight loss during those first 2 weeks, so it really gives people that determination and that drive to continue towards their goals. The rest of the 12 weeks of the program, so weeks 3 through week 12, we consider that the burn phase of the program. During those additional 12 weeks, we have a combination of those meal replacements that I had just mentioned in combination with grocery store foods as well. Those grocery store foods, meals, snacks, whatever it may be, you'll meet with the registered dietitian before we start implementing those. That way you know what those meals should look like to make sure you have those well-balanced and nutritious meals as well. And then the maintenance phase of the program. So once the 12 weeks is over, you have the option to continue to follow up with us. It continues on for 3 months. So each month you can either meet with the physician assistant or the nurse practitioner. And then you also have the option to continue to meet with the dietitian one time during each of those months as well. And after those 3 months are over, since you are a patient of ours at that point, we can continue forward and you can continue to meet with the dietitians after that as well. So the big question is, how do you know if this program is right for you? It's the right choice if you've tried dieting on your own and you haven't had much success, and you need to have that accountability and somebody kind of to show you that direction in terms of that weight loss. If you prefer to lose weight on your own and not have a tool such as maybe bariatric surgery to help you with that. If you're worried about other health issues, such as maybe sleep apnea or high cholesterol or anything like that, having that 30 to 40 pound weight loss during that 12 weeks can show significant improvement in a lot of those medical conditions. Or if you need to lose weight before bariatric surgery, that's always something that we can talk about as well during that time. So the special discount offer that we had mentioned. So if you call before February 6th, you don't have to start the program at that exact date. However, if you call before that date and start and make that initial consult appointment, you can have a $100 discount. So the total fee then would be $499. And again, that's not covered by insurance, but it covers the majority of the fees that are included during that 12 weeks. I also am going to talk about the Regain program that we offer at the Hurley Bariatric Center. This is very similar to the non-surgical medical weight loss program, but it's for patients that have had bariatric surgery and they're looking for that continued accountability after surgery as well. So kind of like I mentioned, who is eligible for the program, you have to be a patient at the Hurley Bariatric Center. Now, if you're a transfer patient, by all means, you can then join the Regain program. However, you do have to be an active patient at the Hurley Bariatric Center. Like I just mentioned, you want to make sure that you're up to date on your visits. So if you have been coming to your 6-month post-op appointment and your 1 year, year and a half, whatever it may be, we want you to make sure that you're active and you've been seeing us throughout that entire process. And you have to be at least 1 year post-op, so at least 1 year post-bariatric surgery. However, it is preferable that you're at least 18 months post-op as well. So how does the Regain program work? And like I said, it's very similar to the non-surgical medical weight loss program. The fee, again, is not covered by insurance. The total fee is $370, and this is actually an 8-week program. So I'll talk about that in a second coming up as well. That fee does cover all of those nutrition supplements that I'll talk about, and it covers all of those visits, the educational handouts, and everything like that. Just like the non-surgical medical weight loss program, we based the Regain program on those 4 pillars of weight management per the Obesity Medicine Association. So nutrition, physical activity, behavior change, and also medication if that's indicated for you as well in terms of the weight loss medication. Like I said, it's an 8-week program. During those 8 weeks, so it still is very individualized. So like I had mentioned earlier, it's not going to be a group program. You're going to come in weekly during those 8 weeks, and you'll have those individual appointments. Again, whether you're meeting with a registered dietitian, a nurse practitioner, a physician assistant, a registered nurse, a medical assistant, whoever it may be, we'll do those weekly weigh-ins. We'll have those labs again that I talked about earlier, that medical monitoring, and then also those educational handouts as well. The jump phase as well is the first 2 weeks of the program. So during those first 2 weeks, we do nutrition supplements again. So it'll be protein shakes, the high protein snacks like the bars, the high protein chips, whatever it may be that you choose. And then the remaining weeks again are those burn phases. That's a combination of those meal replacements and then also grocery store meals and grocery store snacks. And again, you'll be meeting with a registered dietitian before you start implementing those meals and snacks. That way you know what those well-balanced food choices should look like. And then the maintenance phase, of course, since you're a patient of ours, you have the option to continue to follow up with either the physician assistant or the nurse practitioner for the remaining 3 months after the program is over. And then you can also choose to meet with the registered dietitian during those months as well. So if you're interested in either the non-surgical medical weight loss program or the Regain program, you can call our clinic. So that's the number listed there, the 810-262-2330. That's the Hurley Bariatric Center number. So you can give us a call, and then we can help you go from there in setting up an appointment and that initial consult appointment.
Okay, well, that's great information. If you still have questions, she'll answer them now if you text to 248-935-2562. Or post now on Facebook or YouTube. Tracy says, does being on a steroid like prednisone keep you from losing weight?
So, depending, 100%. So, a steroid, it can promote weight gain for you. It really kind of depends on the dose. Now, if that was a medication that you were on and you were looking to be a part of the non-surgical medical weight loss program, it's 100% something that we would take into consideration with your weight. Our nurse practitioners, our physician assistants, they would have more insight with all of that as well. So, it's 100% something that we could talk about, but yes, taking a steroid definitely can affect your weight as well.
How can I stop eating sugar? I'm very addicted to sugar and having a hard time staying away from it.
Yeah, so I love this question. So typically when people are craving things like sugar, it typically means that you're not intaking, I guess, enough calories is a good way to put it, throughout the day. So your body can kind of sense that sugar is a quick and easy energy source for you, and that's sometimes maybe why you're craving that sugar later throughout the day. But there's a lot of things that can affect that. Maybe you're omitting those high fiber, nutrient dense carbs from your meals earlier in the day. So then come later in the day, your body is telling you, I want more carbs, I want more energy, whatever it may be. Maybe you're skipping meals and that's causing your cravings to get worse towards that. During the non-surgical medical weight loss program, we really talk about all of that. If you're struggling with those cravings, with hunger, anything like that, it's something that we would kind of explore a little bit further during that program.
Charlinta says, wants to know about weight loss after menopause. Does it get more difficult, and do you change the plan for someone that's a little bit older?
So it definitely depends on a person-to-person basis. It's hard to just give you a very straightforward answer on that one. I will say we have a lot of women that have gone through the non-surgical medical weight loss program that have gone through menopause, and they're still very successful during the program. Like I said, it's very different for everybody. Some people, it really has no effect on their weight, and some people, kind of what you had mentioned, it does play a big role in that. However, again, that's something during the non-surgical medical weight loss program, when you meet with our nurse practitioner or physician assistant, that they could talk to you a little bit more about that as well, and get more insight in terms of that.
If you've been on TikTok at all, you know there's so much talk about different kinds of shots and things that people are taking now. And Cheryl's wondering if you guys give shots or medications to aid in weight loss.
Yes, so we do. So that would be something, again, that you would talk about most likely with one of our nurse practitioners during those visits. I will say sometimes people think that taking a medication is going to be a quick fix for them, and typically it's those behavior changes that we have to make in order to see that weight loss long term. So typically what we do during the non-surgical medical weight loss program is we really take a look at your eating choices, and during that jump phase, the initial 2 weeks of the program, seeing how your weight loss is going for you. If we continue down the program and we see that you're doing everything that we're asking you to, and your meal choices are looking great, and you're incorporating this physical activity and exercise, and we're still not seeing that weight loss that we want, then 100%. Sometimes medications in terms of shots and things like that, it is something that we can prescribe for you. It just kind of depends on your insurance and I guess what we've tried before that as well.
Can you talk a little bit about like the advantages, because this is a medical facility? Like, I know sometimes doctors will refer patients here, but because we're medical, you can put all that stuff in their MyChart. Your doctor can do your progress, you know.
So, like I keep mentioning, we have many people that are part of the whole program. We really do have a lot of people. We work very close together at our center. The nurse practitioners and the physician assistants, we order all of those labs for you. In terms of where we do our charting, our medical records, it's through a system called Epic, and many hospitals, primary care offices, places like that, they use Epic for their charting there as well. So anything that we chart for you, whether that's your dietitian visits, and I put in all of the notes of what you've been eating, your calories, your weight loss, whatever it may be, whatever you talk to the nurse practitioner about, the registered nurse, the medical assistant, your primary care physician, or if you go to the hospital after that, they will all have access to those results as well, so they can see what you kind of have been working towards and maybe what your goals are in the future as well.
Scott's asking, can I lose weight? I have type 2 diabetes, high blood pressure, and heart disease.
Yes, so Scott, I will tell you 100% you can lose weight. In terms of our program as well, so you are probably familiar then with your A1C, and that's something that we look at throughout that 12-week program. Your A1C, we can really get a good picture on how your diabetes is kind of going throughout that number, and throughout those 12 weeks we can kind of look at that. So we'll take your A1C at the beginning of the program, and then we can also take it again at the end of the program to see if we've had an improvement with that. However, in terms of weight loss, 100%. 100%. So we are all, in terms of the dietitians as well, we are all very educated in terms of diabetes and carb intake and weight loss and how that affects your diabetes diagnosis and everything like that. So 100%. It's just one of those things that sometimes people need to have a little bit more accountability and more of a direction. It's hard in terms of diabetes. There's so much information out there to really know where to go moving forward. But 100% with those diagnoses, you can 100% you can still lose weight with those.
Are there vitamins that you suggest? And Christina also wants to know if there's certain foods that you would suggest for maintaining your weight.
Yeah, so in terms of your vitamins and minerals, that it's hard to give you a straightforward answer without really looking at where your lab values would be currently. I think everybody really should be taking a multivitamin 100%. In terms of specific vitamins and minerals, if you were to be a part of the non-surgical medical weight loss program, there are certain labs that we order in terms of your vitamin B12 and your iron levels and your vitamin D and things like that. And we look at those individual numbers, and if we see that maybe you're deficient in a certain area, or maybe one area is too high, whatever it may be, that's something that we talk about during that program as well. Those were those labs that I was mentioning earlier. So we can help you kind of fix those numbers wherever they may be. In terms of weight maintenance, what I would recommend for you, logging your foods is very, very beneficial. If you log your meals and you can see, okay, if I'm eating, let's say, 1,500 calories and I've been eating this way for a couple of weeks now and my weight is staying the same, well then you know that those are probably your maintenance calories, where if you were gaining weight at that amount, then maybe we need to do a little bit less, that way you can maintain whatever it may be. However, in terms of those food choices, you really want to make sure that you're having those well-balanced meals each day, making sure that you're choosing a lean protein, a non-starchy vegetable, a high-fiber, nutrient-dense carb at each meal to make sure that you're promoting that well-balanced eating, promoting your satiety between meals, managing your hunger. In terms of having that weight management, I guess, it's more of where your maintenance calories would be, which I would recommend starting to log your foods in an app like MyFitnessPal or Bariatric or something like that. That way you can see where those calories are and see if your weight's going up, down, or staying the same.
All right, thank you so much, Hannah. Next, Dr. Christopher Wong is joining us to talk about the surgeries he and his team are experts in, bariatric surgery. There are different types because, let's face it, we're all different and we all have different goals and needs. Now, don't forget, if you have a question for Dr. Wong, he'll answer it live following this presentation. Text your questions to 248-935-2562 or post them on YouTube or Facebook. Dr. Wong?
Thank you. So I'm going to talk about surgical weight loss. It goes hand in hand with what Hannah went through in terms of the non-surgical weight loss. It is just as important, and as Hannah said, we are a huge team at the Hurley Bariatric Center. So the surgical options for weight loss, and some of them we will touch on, things like the gastric band, the gastric balloon, sleeve gastrectomy, the Roux-en-Y gastric bypass, and the duodenal switch. So a lot of you are probably thinking, like, so what is the huge difference between medical and surgical weight loss? Medical therapy, unfortunately, has a lot of limited short success. For as important as it is, the big difference between medical and surgical weight loss is the long-term studies have shown that surgical weight loss is the most effective weight loss that we can offer. Unfortunately, that is still a limited amount. And less than 3% of severely obese patients will maintain a BMI below of 35. It has a higher rate of long-term success in surgical therapy. Some long-term studies that have been done, the largest one was the Swedish obesity study, which was the first prospective study with long-term data that looked at the effects of bariatric surgical weight loss on diabetes, cardiovascular disease, cancer, and overall mortality. This showed that surgery patients lost an average of 18% of their body weight versus medical only lost 1%. And there was a reduction in mortality seen across those comorbidities to be 29%. So the overall studies, unfortunately, for surgical weight loss show that the long-term effects are more effective than medical weight loss. However, they're both important. Weight loss surgery works on a variety of different mechanisms. It restricts caloric intake and also may affect the nutrient malabsorption. As you see here in this graph, some of the surgical procedures like the gastric band, the sleeve gastrectomy, which is the more common surgical procedure done in over 75% of patients in the U.S., the Roux-en-Y gastric bypass, and the biliopancreatic diversion or the duodenal switch. You can see that the gastric band and the sleeve gastrectomy as well as the gastric bypass are primarily a restrictive surgical procedure. The malabsorptive effects, or how your body digests fat and sugar, are not as affected by the gastric band or the sleeve gastrectomy, but more importantly affected by the Roux-en-Y gastric bypass and the biliopancreatic duodenal switch. It also affects both how your body feels fuller, which is known as the enteroencephalic endocrine axis, as well as the enteroinsular endocrine axis, which is how your body digests and breaks down sugar and fat. The feeling fuller faster obviously reduces hunger, and you see that a lot in the vertical sleeve gastrectomy as well as the Roux-en-Y gastric bypass and the biliopancreatic duodenal switch. But the gastric bypass and the duodenal switch also affect how your body digests fat and sugar, which again, as Hannah answered that question earlier, may improve your hemoglobin A1C, and studies have shown over a 5-year period that 90% of patients come off a lot of their diabetic medications after a gastric bypass. So who's a candidate for surgical therapy? Typically patients with a BMI over 40 or more than 100 pounds overweight, BMIs over 35 with a medical comorbidity such as type 2 diabetes, high blood pressure, respiratory disorders, hypertension, non-alcoholic fatty liver disease, or potentially lipid abnormalities, or an inability to achieve healthy weight loss with medical methods for a sustained period of time. As Hannah mentioned, calculating your BMI and kind of knowing where you stand is important. Here is a link to the American Society of Metabolic Bariatric Surgery organization that you can click on, or just search that through Google, and there's a BMI calculator there, which you calculate your BMI based on your weight in pounds and your height. So first we're going to talk about the laparoscopic adjustable gastric band. This is typically an hour-long surgical procedure, typically requires an overnight stay secondary to some narrowing at the gastroesophageal junction. Typical desired weight loss of about 2 to 5 pounds a week, and you adjust the gastric band by filling it with saline or removing fluid to kind of reach that sweet spot for restriction. Unfortunately, single-center studies have reported up to about a 46% estimated weight loss percentage, but this has been difficult to reproduce for a lot of gastric bands, surgical procedures kind of out in the field in terms of reproducing those results. It is less commonly performed at this time. And this is kind of a picture of the gastric band. So it is a foreign body made out of silicone that goes in just at the GE junction, creates a small gastric pouch, and then that port comes out under the skin, and that's accessed with a needle that they're able to fill and remove fluid from the band to adjust the amount of restriction that you feel. This is, a lot of patients feel that this is something that, it's a, hey, I can put this in, lose the desired weight, and then take it out. So that there are some patients, that do undergo this, and they have good weight loss. The next procedure we're going to talk about is the vertical sleeve gastrectomy. As I said, this is the most common bariatric surgical procedure performed in the United States right now, with approximately 70 to 75% of the population receiving this procedure. The goal of the procedure is to remove 80% of your stomach completely, making it a linear tube. It is technically a simple procedure to perform as a surgeon. You preserve the pylorus, which is what empties the stomach, so you don't have to worry about things like dumping syndrome and things like that. The metabolic reduction of ghrelin levels is a measured thing that we do see, and ghrelin is responsible for satiety. All right. There are no adjustments after the initial surgery. You're not going back in and making the sleeves smaller or anything like that. Estimated weight loss percentage at 1 year is approximately 59.3% or 60%, and is typically recommended for patients with a BMI less than 50. This is the surgical procedure here, where you see that you take a linear stapler and actually staple titanium staples across the greater curvature of the stomach, creating a tube-like structure. And that remaining portion of the stomach, where it says X-size stomach, is actually completely removed. It maintains the normal anatomy for your small intestines and colon. It does not change, as I said, how your body digests fat or sugar. The next surgical procedure we're going to talk about is the Roux-en-Y gastric bypass, or the gastric bypass, as a lot of people call it. It is the gold standard of medical surgical weight loss. It's been around for a long time. It is a restrictive and a metabolic surgical procedure. It's recommended for patients with type 2 diabetes. It's also recommended for patients who have very bad baseline acid reflux disease or a history of gastric ulcers. The reason for that is typically patients with vertical sleeve gastrectomies have a 20 to 22% chance of developing new onset acid reflux, but more importantly, 50 to 75% of those patients at 2 years have been shown to have worsening acid reflux after their vertical sleeve gastrectomy. The gastric bypass is typically recommended for patients with a BMI greater than 50. As you can see, in comparison to the vertical sleeve gastrectomy, this is a lot more arrows. It is a lot more complex in terms of the surgery. So what we actually do is we create a gastric pouch, or a small portion of the stomach. Typically, it holds anywhere from 30 to 60 milliliters of fluid. And then we connect that to what's known as the Roux limb, or the Roux-en-Y limb, which is where the food goes. We leave the rest of that remnant stomach in there, preserving the pylorus, which hooks to what's known as the biliopancreatic limb, where the digestive enzymes from the pancreas and the liver go down. Eventually that connects farther down to what's known as the jejunal anastomosis, creating that Y-looking limb. And that's where the food is digested when it hits the digestive enzymes, and that's where you absorb the majority of your calories and fat. And that is what causes the metabolic portion of the Roux-en-Y gastric bypass. The last surgical procedure we'll talk about, which is the biliopancreatic diversion, or the duodenal switch. This is typically recognized as the most effective surgery for maximum estimated weight loss percentage. If any of you have ever watched the Lifetime show, My 600-Pound Life and things like that, that's a surgical procedure that you may see. A lot of the times that surgical procedure is done in 2 parts, with a vertical sleeve gastrectomy and then eventually going back and doing what's known as the duodenal switch. It's most effective for resolution of diabetes and hyperlipidemia. The difference between this and the gastric bypass, or the Roux-en-Y gastric bypass, is it maintains the pylorus, which results in typically less dumping syndrome symptoms. Again, recommended for patients with a BMI over 50. Again, this is a relatively complex procedure. You perform a vertical sleeve gastrectomy, removing, again, 75 to 80% of the stomach. And then the roux limb actually comes up and connects just beyond the pylorus. And then that goes down and, again, connects to the jejunal anastomosis, similar to the gastric bypass. The big thing is it keeps the pylorus, which again helps with digestion and also has been shown to decrease some of the symptoms of dumping. Here at Hurley Medical Center, in our Bariatric Center of Excellence, we offer a variety of surgical therapy. We do both laparoscopic as well as robotic-assisted bariatric surgery. We are the first hospital in Genesee County to perform robotic bariatric surgery. Again, all of our surgeons are facile in a lot of the different techniques as well as the surgical options at Hurley Medical Center. And this is our team of bariatric surgeons. Dr. Farhan is the clinical director, myself, and Dr. Sashwani.
Okay, last chance to get your questions in, either by text at 248-935-2562 or by posting on Facebook or YouTube. Two different people had kind of similar questions. They want to know if they have to go through one of the classes to have bariatric surgery, and also if you have to lose weight and show proof before surgery.
So the classes, yes. Again, as Hannah said, just with the medical weight loss, this is a huge lifestyle change for a lot of patients. Unfortunately, as effective as the surgical procedures are for weight loss, it's not 100%. Unfortunately, patients do regress. They do potentially gain weight, especially if they go off a lot of the lifestyle changes that they made during the 1-year postoperative phase. So maintaining a lot of those good, healthy habits of eating correctly and restricting the amount of food you're eating and eating the right foods, that's important, but also learning the cues that your body is now going to go through in terms of restriction and feeling full, because unfortunately a lot of people do overeat, and that's something that you do learn preoperatively and postoperatively to kind of listen to. In terms of the weight loss before surgery, so that's on a case-by-case basis. Some patients, are at more unhealthy weight for surgery and may have more risks that unfortunately put them at a higher risk during surgery, even for something as simple as a sleeve gastrectomy, which is a relatively less morbid procedure. Insurance also dictates a lot of what the weight loss is in terms of the amount of follow-up. Some patients require a lot longer follow-up with the clinic and have to have documented weight loss. And again, a lot of the stuff that Hannah went through, that is also part of the preoperative phase where you're meeting with the dietitian and the bariatric team and they're monitoring your diet. And a lot of patients, just by changing a lot of the things they eat and how they eat, are able to lose weight as long as they maintain the healthy lifestyle that we enforce and try to promote.
Patty asks, with vertical surgery, what is the length of hospital stay?
So the vertical sleeve gastrectomy can typically be anywhere from a overnight stay. So after patients have surgery, they're already started on the clear liquid diet. They're already starting to get up and move around. And then after that, typically patients the next day are reevaluated by the surgeon, myself, and the nursing team to see whether or not they're able to go home. And a lot of the times it's just, are they having nausea and all that, and able to tolerate the protein and the liquids that they're on. There are some patients that their insurance recommendations are for just for outpatient surgery. We've been doing that for almost a year and a half with very good success. Again, a lot of these patients, especially during COVID, were kind of pushed to the possibility of outpatient surgery, which we're doing only at this time for the vertical sleeve gastrectomy. patients are doing very well. Being able to go home and check in with the team the next day is important, but I think knowing that that might be a possibility and getting that in their mind, patients are usually pretty happy with the possibility of spending the night in their own bed.
And then how long before you can drive?
So again, we don't recommend them drive in right away, especially, with the post-operative pain and everything like that. It kind of just depends. Most patients within the first 2 weeks are usually at that point safe to drive, as long as they're not on any pain medication, and they're not having any side effects of the surgery in terms of nausea and lightheadedness, dizziness.
Richard says, what percentage of your patients keep the weight off at 1, 2, and 3 years?
Again, the national average for this, unfortunately, is anywhere from 10 to 50%. It just honestly depends. It's a huge variety, or a huge variant in terms of the amount of patients. Unfortunately, with our patients, comparatively like sleeve gastrectomy and gastric bypass, it's it's a huge kind of widespread amount. Surgical weight loss, unfortunately, from the standpoint comparing to medical weight loss, is not 100% as it should be. Within the Michigan Bariatric Society, there's a lot of work we could do. We all wish that patients could keep the weight off long term. Unfortunately, as Hannah said, genetics and things like that plays a relatively big role. Success is difficult to gauge, I think, unfortunately, for patients, because a lot of patients get fixated on a number in terms of how much weight they want to lose for them to be a success after surgery. I think the big thing as a bariatric weight loss surgeon, especially and also within the bariatric center at Hurley, the goal is to take a patient who may be very unhealthy because of a lot of their comorbidities and reduce that risk. So if you're coming down from 2 hypertension medications down to 1 or none, or 3 or 4 diabetic medications down to 1, that's a huge win. And maintaining those lifestyle changes is important.
Can you talk, Sheila had messaged about some issues that she was having after her surgery with alcohol. Can you talk about that as a possible side effect?
So again, the healthy living that we kind of promote at the Hurley Bariatric Center is kind of widespread, right? We typically talk about patients preoperatively not smoking. They need to get off nicotine or any supplements, things like that, in order to undergo surgery, because it does cause issues in terms of healing. Same thing with alcohol and any illicit drugs or anything like that. That is difficult depending on the type of surgery you have. Post-operatively, alcohol intake can affect how your body reacts to it. If you've had a gastric bypass or biliary-pancreatic duodenal switch, because it changes the way your body absorbs fat and sugar, it also changes how your body processes and digests alcohol. So if you continue to drink after a gastric bypass surgery, you actually can cause more damage to your liver, because it doesn't go through the liver in terms of digestion, and you may not actually show any signs of being intoxicated or being under the influence of alcohol. We try to promote, if you're going to make the changes to improve your body, lose weight, be healthy, get off medications, that you kind of take the approach that alcohol, smoking, and all those things are also things that you want to try to cut out of your life in order to maintain that healthy lifestyle.
Do you know what the wait time is for Medicaid insurance?
12 months. Yeah, 6 to 12 months.
Okay. Is gastroparesis common after weight loss surgery?
It can happen. It's not typically super common depending on the type of surgery you have. either the vertical sleeve gastrectomy and or the Roux-en-Y gastric bypass, it is incredibly rare because the majority of your stomach in the gastric bypass is removed or disconnected.
Kayla says, I'm 65 years old, heart bypass patient, looking to lose weight but concerned of the risks.
So again, if you come in and get evaluated both for, a surgical consultation, you also meet with, the dietitians, our nurse practitioners in the preoperative phase. Depending on your medical comorbidities, especially after heart surgery and things like that, some patients, are pushed from the surgical consultation into the medical weight loss to potentially lose weight, to see if their risk of surgery goes significantly down, and then move back over to the surgical side. But again, from the standpoint of post-bypass surgery and things like that, again, cardiac clearance is necessary from your cardiologist, but a lot of cardiologists, the risk and benefit is pretty high in terms of the benefit for patients undergoing weight loss, and that usually is going to decrease a lot of their cardiovascular risk after they lose weight. So a lot of cardiologists are on board usually with weight loss surgery.
Okay, great information. We hope it helps you make the best decision for your weight loss and your journey to better health. Here's the number to make an appointment, 810-262-6330. If you're considering bariatric surgery, you want to head over to hurleymc.com, and the steps are spelled right out there for you. Thanks for joining us, and thank you Mid-Michigan Now for helping us encourage healthy living through these live online events. Have a great day, everyone.